Welcome to This Explainer. Today, we're diving straight into the hidden physical struggles of John F. Kennedy and the pioneering doctor who literally kept his political dreams alive. You know, we usually picture JFK as this ultimate symbol of youthful vigor, right? But the actual truth behind that public image? Well, it's a completely fascinating story of medical detective work, intense physical agony, and some seriously groundbreaking innovation. Just take a look at this. Behind closed doors, JFK's daily reality was vastly different from what the public saw. By the mid-1950s, he was relying heavily on crutches, struggling just to walk from his car to a building. He'd already endured 4 completely failed back surgeries. I mean, the pain was so severe that a previous surgeon even tried to fuse, or basically lock, his back. But the agony just wouldn't quit, and it was entirely threatening his political ambitions. Compare that painful reality to this youthful, athletic image from his military service. It's night and day. But here's the catch. Projecting a robust, energetic persona was exactly what he desperately needed to do to win over the American public. Because to win the presidency, especially with that super intense 1960 election cycle looming right around the corner, he simply couldn't afford to look weak. His political opponents were completely ruthless, always hunting for any vulnerability, and they absolutely wouldn't hesitate to attack his health. JFK knew that to survive the campaign trail, he didn't just need a Band-Aid or a temporary fix. He needed a true medical breakthrough. Section 1. Enter Dr. Janet Travell, the medical detective. That much-needed breakthrough finally arrived in 1955 when JFK's surgeon brought in a brilliant, Cornell-educated physician whose approach to pain was literally about to change the course of medical history, and American history right along with it. As you can see right here in this classic image of Dr. Travell standing with President Kennedy at the White House, she would soon become an absolute fixture beside him. She made history in her own right as an indispensable medical confidant. But her journey actually started in a completely different field, cardiology. And it was there that she noticed something truly fascinating. While she was treating these heart patients, Dr. Travell realized something huge. Many of the people suffering from what felt exactly like a heart attack or angina pain didn't actually have heart disease at all. Instead, they were experiencing intense spasms in their pectoral muscles. Get this, she even experienced it herself. So to prove her theory, she had her father, who was also a doctor, inject procaine, which is a local anesthetic, directly into her tender muscle spots. And miraculously, the radiating pain just vanished. This relentless curiosity led her to organize the study of muscle pain and actually coin a brand new medical term, the myofascial trigger point. Before Dr. Travell, unexplained muscle pain was kind of just a medical mystery. Nobody really knew what to do with it. But she turned that vague symptom into a targeted, systematic, and highly treatable condition. She basically began meticulously mapping the entire human body. Take a look at this diagram. She proved exactly how specific, hyper-irritable muscle points, like those X marks you see on the neck, can actually refer pain to completely different areas, which are the solid red zones mapped out on the head and face. It was an absolute masterclass in medical connect the dots. Section 2. Treating the future president. So when Dr. Travell officially took over JFK's care in 1955, she didn't just focus on his spine, she looked at his entire muscular system. She implemented this incredibly multifaceted, highly specific conservative treatment plan with one primary goal: to literally get the senator standing up on his own 2 feet again. Her interventions were ridiculously precise. First, she used those targeted procaine injections right into the aching muscles of his back. Second, she used a unique spray and stretch technique to relieve the muscle tension. And third, and I think this is just brilliant, through careful examination, she noticed that one of his legs was actually shorter than the other, which was causing asymmetric strain on his gluteal muscles. Her solution? A deceptively simple custom shoe lift to level him right out. Well, her meticulous approach worked absolute wonders, eventually helping him win the 1960 election. Which brings us to Section 3, redesigning the White House. Because when JFK moved into the Oval Office, you better believe he made sure Dr. Travell came right along with him. Breaking all sorts of tradition, JFK appointed Dr. Travell as the official White House physician. Historically, this role had been reserved exclusively for commissioned military officers. So she wasn't just the first civilian, she was the very first woman to ever hold the position. And she took on this massive responsibility at the age of 60, a time when, most people are starting to look toward retirement. Once she was in the White House, she completely revolutionized his environment. She famously prescribed a highly specific piece of furniture, a custom rocking chair. Dr. Travell knew that static sitting was terrible for his back, and the rocker forced his muscles to stay in constant, gentle motion while he worked. It became so iconic that rocking chairs actually swept across American homes as a massive trend. But she certainly didn't stop at chairs. Her ergonomic engineering went everywhere the president went. Just look at these highly specific hand-drawn schematics. She completely redesigned his press conference lectern to suit his exact height and posture, and even went so far as to modify his custom seats on Air Force One. She was essentially modifying the presidency itself to fit the physical needs of the man. Section 4. The legacy and the limits of treatment. Dr. Travell's legacy is, without a doubt, absolutely immense. By bringing her trigger point therapy to the most famous patient in the world, she fundamentally shifted how the entire medical field approached and eventually solved the mystery of referred pain. After JFK's tragic assassination, she actually stayed on to serve President Lyndon B. Johnson. She later returned to academia, lived to the remarkable age of 95, and in 1983 co-authored the definitive medical textbook with Dr. David Simons. The Trigger Point Manual remains a gold standard in diagnosing and treating muscle pain to this very day. She even used her expertise to help design commercial tractor seats and airline chairs. Talk about a lasting impact. Yet, for all her brilliant interventions, for all the rocking chairs, the custom lecterns, and those textbook-defining discoveries, if we really look closely at the historical data, we have to pause and ask a pretty crucial, lingering question. Did she actually cure JFK's underlying agony? The answer, kind of hidden behind the curtain of Camelot, is definitely complex. Medical records actually reveal that between 1955 and 1961, Dr. Travell was injecting JFK with Procaine almost daily. We are talking about hundreds, perhaps even thousands of injections over those years, literally just to keep him functional. Because the hard truth is, the pain persisted. Treating the muscle spasms just wasn't the complete answer. Driven by this chronic agony, the president was forced to seek out other avenues, from exercise specialists like Dr. Hans Kraus to some highly controversial alternative treatments. This desperation ultimately opened the door for the infamous Dr. Max Jacobson, widely known to celebrities as Dr. Feelgood, who administered, let's say, questionable mixtures to the president. And it leaves us with a profound thought to walk away with today. No matter the medical brilliance at hand, what are the true limits of medical intervention when a human body is failing, but the weight of the entire free world is resting squarely on your shoulders?